Common sports medicines. Introduction to the module. Sports medicine is concerned with physical health as well as the treatment and prevention of sports and exercise-related injuries. This module covers some common sports medicines that are used by athletes. You will also get to know about the symptoms, signs and first aid procedures for common sports injuries. It should be noted that this course will try to give you a general overview of sports medicine and its use. But, we always suggest that you consult with your physician before taking any kind of medicine. Topics to be covered. Non-Steroidal Anti Inflammatory Drug, NSAID. Muscle Relaxants. Steroids. Antibiotics. Head, spine and nerve injuries. Non-Steroidal Anti Inflammatory Drug, NSAID. Non-steroidal anti-inflammatory drugs, NSAIDs, are used to treat pain and fever, as well as to reduce swelling and inflammation caused by injuries or diseases like arthritis. The most common traditional NSAIDs include aspirin, ibuprofen, Motrin, Advil, Motrin IB, naproxen, naproxen, Aleve, nabumetone, Ralofen. Side effects and health risks of NSAIDs. NSAIDs may have side effects. The most common side effects are stomach upset, heartburn, and nausea. NSAIDs have the potential to irritate the stomach lining. Long-term use of NSAIDs can cause stomach ulcers and high blood pressure. They can also cause a life-threatening allergic reaction. NSAIDs can also increase the risk of heart attack, stroke, skin reactions, serious stomach and intestinal bleeding. All these risks increase if NSAIDs are taken at higher doses or for longer periods than recommended. NSAIDs should be taken exactly as prescribed or according to the label. Taking higher dosage or continuing on medication for longer than recommended can lead to harmful side effects. Aspirin should not be given to anyone younger than 20 because of the risk of Reye syndrome, a rare but serious disease. Muscle relaxants. Back and neck pain is often caused by tense, spasming muscles. Muscle relaxants can be prescribed if the pain is severe or chronic and does not respond to over-the-counter medicines. Muscle relaxers. Reduce skeletal muscle spasms. Relieve pain. Increase mobility of the affected muscles. Muscle relaxants are used to alleviate pain in addition to rest, physical therapy, and other methods. They are usually used to treat acute, painful musculoskeletal disorders for a short duration. Muscle relaxants are often used to treat chronic pain. Muscle relaxers do not have all the same chemical structure or function the same way in the brain. Instead, the term muscle relaxer refers to a class of medications that function as central nervous system depressants and also have sedative and musculoskeletal relaxant properties. Muscle relaxers are also recommended for other conditions such as fibromyalgia, multiple sclerosis, seizure disorders. Back pain is usually treated with a variety of muscle relaxant drugs. Common muscle relaxants. Muscle relaxants are often used in combination with rest and physical therapy to relieve back pain. Common muscle relaxants include baclofen, benzodiazepines, shirisoprodol, chlorzoxazone, dantrolene, metaxalone, tizanidine. Side effects associated with muscle relaxers. Side effects of muscle relaxers include sleepiness or grogginess, fatigue, dry mouth, nausea, lightheadedness or fainting, blurred vision, confusion, urinary retention. Steroids. Anabolic steroids are a class of natural and synthetic, manufactured, substances that are related to the major male sex hormone, testosterone. Anabolic steroids promote the growth of muscles and can make bones stronger and reduce body fat. In addition, all anabolic steroids are androgenic. This means they cause male characteristics, such as male patterned baldness, facial hair, and deepened voice. However, steroid precursors can be converted into the major female hormone, estrogen, because of their chemical structure. This can cause breast enlargement in men. Some common anabolic steroids: Anadrol, Danazol, Dianabol, Winstrol. Some possible health effects include increased risk of liver, kidney, and prostate cancer, documented in laboratory animals. High blood pressure, which increases the chance of heart attack and stroke. Abnormal cholesterol levels, which increases the chance of heart attack and blood vessel disease. Early stopping of bone development and linear growth, height. Damage to the liver, including the formation of blood-filled liver cysts that can rupture. In males, shrunken testicles and temporary inability to father a child, breast formation, and baldness. In females, smaller breast size, irregular menstrual, monthly, cycles, masculine appearance, particularly facial and body hair, and deep voice. Psychological symptoms include mood swings, sleep disruption, aggressive behavior, extreme irritability, delusions, paranoid jealousy, euphoria, depression. Antibiotics. Antibiotics are a group of medicines that are used to treat infections. Antibiotics are sometimes called antibacterials or antimicrobials. Antibiotics can be taken by mouth as liquids, tablets, or capsules, or they can be given by injection. Antibiotics are a group of antibiotics used to treat infections. Antibiotics are also used as antibacterial or antimicrobial medications. Antibiotics may be taken orally as liquids, tablets, capsules, administered intravenously. It's significant to mention that antibiotics are only effective against infections caused by bacteria and parasites. A parasite is a form of germ that requires the presence of another living being to survive. Host. Antibiotics are ineffective against infections caused by viruses such as the common cold or flu, fungi such as thrush in the mouth or vaginal thrush, fungal infections of the thigh. Antibiotics are available in a variety of forms and under a variety of brand names. Antibiotics are usually grouped together on the basis of their working procedure. Each type of antibiotic is only effective against a specific type of bacteria or parasite. This is why different antibiotics are used to treat different types of infection. The main types of antibiotics include penicillins, for example, phenoxymethylpenicillin, flucloxacillin and amoxicillin. Cephalosporins, for example, cefaclor, cefadroxil and cephalexin. Tetracyclines, for example, tetracycline, doxycycline and limecycline. Aminoglycosides, for example, gentamicin and tobramycin. Macrolides, for example, erythromycin, azithromycin and clarithromycin. Clindamycin. Sulfonamides and trimethoprim, for example, cotrimoxazole, metronidazole and tinidazole. Quinolones, for example, ciprofloxacin, levofloxacin and norfloxacin. Nitrofurantoin, used for urinary infections. When are antibiotics usually prescribed? Most common infections are caused by viruses when an antibiotic will not be of use. Even if you have a mild bacterial infection, the immune system can clear most bacterial infections. For example, antibiotics usually do little to speed up recovery from most ear, nose and throat infections that are caused by bacteria. Antibiotics are required if you have some severe bacterial infections, such as meningitis or pneumonia. In such situations, antibiotics are often life-saving. Antibiotics are sometimes used to avoid the spread of urine infections to the kidneys. Acne, a less serious condition, can also be treated by antibiotics. The choice of an antibiotic mainly depends on the infection and the germ, bacterium or parasite, that is causing infection. This is due to the fact that each antibiotic is only successful against specific bacteria and parasites. Other factors that influence the choice of an antibiotic are how severe the infection is, how well the kidneys and liver are working, dosing schedule, other medications you may be taking, common side effects, a history of having an allergy to a certain type of antibiotic, the pattern of infection in your community, the pattern of resistance to antibiotics by germs in your area. Side effects of antibiotics. Possible side effects are severe watery diarrhea and stomach, abdominal cramps are signs of a serious gut bacterial infection called Clostridium difficile. Shortness of breath, hives, rash, swelling of the lips, ears, or tongue, and fainting are the signs of an allergic reaction. Signs of vaginal thrush include scratching and discharge in the vaginal region. Oral thrush is shown by white spots on the tongue. Being sick, vomiting. Head, spine and nerve injuries. Head injury. If an athlete receives a hit to the head or a whipping of the head and neck, search for symptoms and signs of injury immediately. Causes. Direct blow to the head. Sudden, forceful jarring or whipping of the head. Ask if experiencing symptoms. Headache. Dizziness. Ringing in the ears. Grogginess. Nausea. Blurred or double vision. Check for signs. Confusion. Short-term memory loss. Breathing patterns that are irregular. At the point of the blow, there is bleeding or a cut. Leaking blood or fluid from the mouth, nose, or ears. Numbness or weakness in arms or legs. Neck pain accompanied by a decrease in motion. Vomiting. For injuries with more serious signs such as confusion, unsteadiness, vomiting, convulsions, increasing headaches, increasing irritability, unusual behavior, arm or leg weakness or numbness, neck pain with a decrease in motion, pupil abnormalities, or unconsciousness, do the following. 1. Immediately call emergency medical services. 2. Monitor the athlete for breathing difficulty and perform CPR if necessary. 3. Control any profuse bleeding but avoid applying excess pressure over a head wound. 4. Monitor for shock and treat as needed. 5. Immobilize any fractures or unstable injuries as long as it does not jostle the athlete, which may worsen their condition. Possible spine injury. Causes. Direct blow. Compression. Torsion or twisting. If you suspect a back or spine injury, look for these red flag symptoms and signs. Ask if experiencing symptoms. Pain over or near the spine. Numbness or tingling in the feet or hands. Check for signs. Responsiveness. Inadequate breathing. Profuse bleeding. Blood or fluid leaking from the mouth, nose, or ears. Spine deformity. Paralysis. First aid. If any red flags are present, assume the athlete has a spine injury and administer appropriate first aid. 1. Send for emergency medical assistance. 2. Without moving the athlete, check for breathing. If the athlete isn't breathing, have someone keep the athlete's head and neck steady when performing CPR. 3. Stabilize the head and neck before EMS takes over whether the athlete is breathing. While stabilizing the head and neck, leave the athlete's helmet on. 4. Control any profuse bleeding but avoid applying excess pressure over a head wound. 5. Monitor and treat for shock if necessary. 6. Let EMS immobilize any other possible fractures or unstable injuries. Possible nerve injuries. Burner or stinger. A burner or stinger occurs when a group of nerves, brachial plexus, coming out of the neck and running to the shoulder are overstretched. Cause. The head is flexed or extended and forced quickly to one side and tilted down. Ask if experiencing symptoms. Tingling or burning in the neck, shoulder, or arm. Electrical shock sensation in the neck or shoulder. Arm feeling dead or heavy. Check for signs. Arm or hand numbness on one side. Arm or hand weakness on one side. First aid. If sensation and strength do not return within 5 minutes, or there is tenderness or deformity of the spine, do the following. 1. Send for emergency medical assistance. 2. Stabilize the head and spine. 3. Monitor breathing and provide CPR if needed. 4. Monitor and treat for a shock as needed. 5. Stabilize any other unstable injuries. If the sensation and strength return within a few minutes, call the athlete's parents or guardians and have them take the athlete to their physician. Summary. In this module, we have covered the following. Non-steroidal anti-inflammatory drugs, NSAIDs, are used to treat pain and fever, as well as to reduce swelling and inflammation caused by injuries or diseases like arthritis. Long-term use of NSAIDs can cause stomach ulcers and high blood pressure. They can also cause a life-threatening allergic reaction. Muscle relaxers are also recommended for conditions such as fibromyalgia, multiple sclerosis, seizure disorders. Anabolic steroids promote the growth of muscles and can make bones stronger and reduce body fat. Antibiotics are a group of antibiotics used to treat infections. Antibiotics are also used as antibacterial or antimicrobial medications. The main types of antibiotics are penicillins, cephalosporins, macrolides, quinolones, etc.